I wrote this paper 7 years ago, and I've been thinking about it since listening to the Retrievals podcast. Just like low C-section rates, low rates of general anesthesia for C-section are considered to be a positive quality metric on labor and delivery units. In this article, we were looking at patients who had epidurals already in place for labor and then went on to have a C-section and what their risks were for having to be put to sleep for their C-section. I mentioned in the paper that the Royal College of Anesthetists say that the rate of general anesthesia for these patients should not exceed 3%. The idea is that if the anesthesiologists are managing the epidurals properly, everything from knowing the best ways to put them in, to dosing them properly, recognizing early when an epidural is not working early enough to be able to replace it before the patient has to go for a C-section, then that would be reflected in a lower rate of general anesthesia. The C-section rate at my hospital at that time, which we talk about in the paper, was around 30%, basically around the national average, but our general anesthesia rate for C-sections was only 1%, which is quite low. This is a quote from the paper. At our institution, the culture is such that both anesthesiologists and obstetricians seek to avoid general anesthesia in obstetric patients whenever possible, and all labor, epidural, general anesthesia cases are reviewed as part of our quality assurance process. The assumption was, of course, that if the epidural didn't work for whatever reason, then the patient is put to sleep. But I couldn't see the patient's perspective when I did my retrospective chart reviews. We didn't have pain scores charted or patient surveys or anything like that I could look at. At the time, I didn't think that suboptimal anesthesia was a big factor, but honestly, we couldn't prove it. I still think the concept that we need to be proactive about monitoring our epidurals, making sure they're working in labor, and knowing how to dose them properly for C-section is really important. But I'm just really glad that we're also now starting to talk about making sure these epidurals are actually giving moms the pain relief that they truly need and deserve during their C-sections.